All right. So welcome back, everyone. I hope you had amazing conversations about food. We love talking about food. And I forgot to go to this screen when we were first coming in. So this is what we were doing today. Um, and continuing to, oh, people seem to have fallen out. Still coming back into the meeting. So we just did our gathering and chatting with each other about when you think about feeling well, what role does food play? And now we're going to get started on our updates. So I hope everybody's ready to share your updates. We don't have a lot from our partners today, but we're starting with the food bank. So I want to invite Elsie to share about the Pulse on Hunger for this month.
Hi, everyone. My name is Elsie Cipriani. I'm the Executive Director of the New Hampshire Food Bank. For the month of April, our total distribution pounds was 1,694,000, up to 5% increase compared to March, and actually 20% increase compared to the same time last year, so April 2025. The total distribution year to date has been more than 6 million pounds of food. We had a total of 18 applications. That equals more than $20,000. And the impact in the local economy is 30,000. The total meal equivalent for year to date is more than 5 million pounds of food. I also want to highlight, so we started tracking some specific data, and we can see that one of the things that we want to determine is the amount of protein, the amount of dairy, the amount of healthy food that we are distributing, healthier food that we are distributing. And thanks to the data that we are currently tracking, we can see that during the month of April, 63% of the food that we distributed through our partner agencies and through our mobile food pantries were related to foods to encourage. That means that 63% of the food that we distributed and a little bit more because we are missing a couple of the mobile food pantries were fruits and vegetables, grains, protein, and dairy. And as I mentioned, compared to last year, our distribution this month increased 20%.
I see John has a question.
No question. Hold on. I just have to go off the air for.
Okay. So I do have a question, Elsie, with all of this increase that you're having to meet, is it a challenge to get the supply, and especially you're getting healthier supply and fresh supply? Is it a challenge to get all of that supply to meet those needs?
It has been. We definitely are seeing already an increase on the food that we are purchasing, especially outside of New Hampshire. Our food procurement manager has been tracking this very closely. So I will say from January to March, we didn't see a significant increase, but last month, April, she already started sharing that she's getting emails and calls from our providers or our food providers from our vendors saying that they definitely are going to start increasing their prices. So we'll see in the upcoming months what the overall effect is going to be.
Anything that you want community partners here on the call to be thinking about, or how they could be helpful with these challenges?
Just keep open communication. It's always helpful for us to know what our partners are seeing because, again, we don't do a lot of direct distribution. So communicating directly with us, letting us know what are the main needs and how we can continue partnering with them to help with those needs, that will be very helpful.
Yeah, thank you so much. It fits with the trends that we're seeing with other things that this should be the kinds of challenges that you'd be seeing right now. So
I also want to take advantage and share a couple of updates in terms of our overall programs. During, I believe, a couple months ago, we shared of the grant that we received from Feeding America to enhance our fresh rescue program. So locally, everything is in progress right now. We were able to lease 3 refrigerated cargo vans across the state. So one van is going to be located in the Littleton area. Another van is going to be located in Lebanon, and another van is going to be located here in Manchester. So if anyone wants to get more information on how to get access to this van to start using them, and also to our volunteers, they can reach out directly to our, I'm going to provide the information in the chat later. The email address and the name of the person managing this program is Hudson Wells, and I'll provide his contact information. He had a Zoom call last week with many of the partners that are interested in joining the program and start rescuing more food. So he will be happy to hear more from more partners in case that they are interested.
Yeah, and I see a question. If you don't mind, Kathleen, did you have a question? You're muted.
No, but I have a comment about the food bank. Just recently, months ago, they started a separate program for people who live further away from the food bank, second drop-off spots for us that live up in Lyme. And we really appreciated that. So I just want to thank you for responding to people's, the food bank need or the food pantry needs. So.
Thank you. And thank you for highlighting that, Kathleen. This is one of the models that we are trying. So we have been doing mostly mobile food pantries, the regular mobile food pantries. So what we want to do is that instead of hosting 4 regular mobile food pantries every month, we are hosting the 2 regular ones and 2 new, we call it drop-offs. And these are, we are trying to do more fresh food, produce, dairy, because this is what the agencies have been asking across the state. So hopefully we can continue doing the same next year.
Thank you. And did you have more updates, Elsie?
I think that's it for now. I think I have another slide for overall information.
First, SNAP outreach?
Yes, SNAP outreach. We continue. Right now, we have 3 people in this program. If anyone is interested, we still have 1 vacancy. We are currently recruiting for SNAP outreach coordinator. So if you know anyone, please send them our way. We'll be happy to conduct a screening with them. And if anyone needs information, materials, we'll be happy to provide those to you. Just scan the QR code or email directly to Heidi Johnson.
Thank you so much, Elsie. And
Thank you, everyone.
I might have you back in a second for SNAP Coalition. I'm not sure unless Heidi's here, but we have another slide in the meantime.
Okay, she's not here, so I'm happy to help.
Okay, all right. Just for a moment, popping over for Amy to share about this lovely program.
Yeah, I think I spoke about this last month, but since it's still prime garden planting time, I thought we would highlight it again really quick. I'll put a link in the chat to a full post with sort of like all the information. But just like Elsie is highlighting with New Hampshire Food Bank, the demand is increasing for food in the state. The cost of food has risen more than 25% in the last 5 years. 1 in 7 children in New Hampshire are food insecure. Food Bank hit more than 20 million pounds of food delivered last year. So, looking for ways that we can help address that, since we are the Food Access Coalition, and thinking about gardens that we all are, not all of us, but some of us are thinking about right now. Gardening itself has a number of health benefits for us as gardeners, but also it can be a way to experience making a difference for our neighbors. And that can be really crucial for our own well-being and sense of agency, as well as for our community's well-being, building connection and resilience at the community level. And I think hunger is a way that a lot of people resonate with and are interested in doing more, trying to figure out what to do. So gardens can be a way to help. So that's what this post is about. you're welcome to take a look. And there's a lot of resources linked there. Our friends at Kearsarge Food Hub, I love they all say we all got to eat, right? And we all deserve to be well nourished too. Most pantries do want to accept fresh produce, but you know, there's a lot of pantries. They are small. A lot of them are very much volunteer run. They might be new to it, so you know, taking some time to kind of look this through, know what to expect, sort of make sure that you work with the pantry so that they know what to expect and you guys can work together to get that fresh produce out to your neighbors. So I will put some more links in the chat, but that was the reminder here. And if anyone has questions, feel free to reach out to me.
Thanks so much, Amy. What a great idea. Coordinating all of that good work. And just in case there are any more partners that have updates that you want to share at this moment, I'll take a moment and see if anybody raises a hand. And if not, we'll move on to coalitions, and then coming into our statewide coalitions. Here is a list of our statewide coalitions and when they meet. And we're rolling around to the SNAP coalition. And this is a partnership. Actually, Elsie, I think I can pretty much speak to it and let you off the hook. So
Great, thank you.
Yeah. They meet third Wednesdays of the month at 10 a.m., which is going to fall on June 17th, this next one. And yeah, go ahead, Kathleen.
I didn't mean to interrupt you, but I just wanted to know, I think I asked this at the last meeting, if we can get data that is drilled down below the county level for SNAP data. Could we get community level data for SNAP in New Hampshire?
I'm not sure. I think I'm going to offer it to the partners to take that into the chat and see if anybody knows better than I do on this.
We have our map on our New Hampshire Hunger Solutions website as well. That might be a good place to start.
Yeah, thank you, Riona. It's getting, up-to-date data and granular data is always a challenge. So if anybody knows more than what we have on the New Hampshire Hunger Solutions website, we're always happy to hear about those sources. Yes, and Ray, it sounds like you have something on this topic.
Sorry, can you hear me okay? I'm on my phone because I'm traveling today. Yeah, I can just add that some of us from the SNAP Coalition are hoping to have a conversation with the Department of Health and Human Services about the possibility of making some data more regularly publicly available. It is shared sometimes before a few, I think, legislative committees, and it does get shared in a couple of other spaces, but it's not really posted publicly. And during the pandemic and the public health emergency, there was a dashboard that the agency posted online that had some information. And so we would like to ask them if they're willing to do something similar, especially as a lot of the SNAP rules have recently changed due to federal changes in federal law. Many of us are interested in kind of tracking how those changes impact access to SNAP and SNAP enrollment. So, and certainly it is available through, a right to know request under our, public records law. So, New Hampshire Legal Assistance has done that in the past, but we're really hoping to work with the state to try to make it more regularly accessible without having to file an official right to know request.
Yeah, thank you. Thank you. I think that was like unanticipated conversation, but something a lot of people are thinking about. And I appreciate bringing it into this coalition, which is a little bit wider of a coalition, and letting anyone else know that this SNAP coalition meets pretty much every month and throughout the year. And you can really dig down into the SNAP questions. And SNAP is, of course, extremely impactful and undergoing a lot of challenges. So June 17th is the next meeting. All of these topics will be discussed, and as well as we're going to have a special focus in the June meeting on regional coalitions and the efforts to amplify SNAP outreach. So I'm coordinating some of that. So folks from regional coalitions, if in your regional coalition you're working on this, I definitely want to hear from you and help organize a little presentation and exchange about that. Any other regional coalitions with an update or announcement before we move on to policy? All right, so I'm going to invite Finn. Well, first, here's the slide that shows you when regional coalitions meet. This will be in the notes. And moving to policy updates.
Awesome. Thank you, Sarah. Hey, everyone. I'm Finn Shea. I'm the Director of Communications and Grassroots Policy at New Hampshire Hunger Solutions. I apologize for my audio. It's a little bit echoey in here. We just moved and have nothing on the walls or the floor, so I sound a little bit like I'm in a giant cavern, but bear with me here. Thank you. So wanted to give a bit of an update on the state level policy, but then also dig just a little bit deeper into the Farm Bill because it's something that we've been talking a lot about and kind of talking about legislative actions regarding the Farm Bill. So wanted to dig into that a little bit more as well. So just a fairly quick policy update because we're really at the end of the legislative session here. So update first on bills that we are supporting. SB 603 is a bill that would have ordered DHHS to find the money to run the SNAP program. SB 603 was killed, although the substance of it was then added to HB 1574 as a non-germane amendment, so an amendment that just has nothing to do with the original bill. 1574, unfortunately, was also killed. I think partially, if not all, because of the non-germane amendment. Unfortunately, that was added. This bill would have extended free and reduced lunch for special education students up to age 22. It was sent to a committee of conference, and that was killed yesterday morning. Next slide, please. Thank you. SB 517, know that we had talked about that in the past, is the bill that would have raised free school meals to 200% of the federal poverty level. Schools by half. That was tabled earlier, a little bit earlier in the session. The bill that we are currently getting updates on because it is in committee of conference right now is HB 1727. So this is one that would allow the DOE to collect student addresses and share them with DHHS for the sole benefit of distributing summer EBT cards so students don't fall through the gaps.
And Ben, can I jump in?
Yep, please do. I was going to ask if you were here.
I just got back from the committee of conference. So they agreed on a version of the bill that would require schools to send the names and addresses of the of children who are on free and reduced meals, but not on other programs to the DOE. To DHHS, who administers summer EBT. So people will be able to get their EBT cards without having to do more things, because the way that they've been doing it recently was they were setting up a portal on their website, which didn't catch many of the people who were eligible. So about 5,000 kids, 5,000 families were missing out. So this bridges that gap. So it still needs to pass the House, but I'm hopeful.
And I think is it true, Laura, that the portal missed like 97% of families or something? Like some ridiculous number of people.
Yeah, there were about 60 families who participated through the portal. Yeah.
Yeah. Oh, Kathleen, did you have a question?
Yes, I do. I wanted to know how this compares to the Vermont program because we've been getting a lot of I straddle the fence, I guess, information where you go and pick up the lunch for the kids, or you have access to the lunch. But in New Hampshire, you're going to give the EBT cards so that
So there are
they
two,
can go and get whatever.
so there are two distinct programs that we're talking about. Summer EBT is the program where people are sent EBT cards if their children are on free and reduced meals during the year.
Mhm.
But the summer meals program is a different federal program that allows schools and community-based sites to offer meals during the summer, site-based meals
Okay.
or pickup meals, some of them depending on eligibility. Yeah. Does that make sense?
Thanks.
Awesome. Thank you. So again, quick overview. And I believe that we had these updates last time, but just wanted to reload a little bit. So SB 615 would it was originally a bill that would have been really detrimental and really hurt um, our neighbors and communities, but also the local businesses and retailers and economy in general. So we very much oppose the original version. The Senate amended the bill to create a commission to study the bill. So we're, very much in favor of the amended bill. It did end up passing, so we'll be going to study commission. So we'll have the opportunity to study more in depth the impact that it would have on people in New Hampshire and on our retailers, on our neighbors. So last one is HB 1797. So this one was sent to interim study, different from study commission, but this is the bill that would have cut SNAP eligibility and added outdated asset tests. I believe this was effectively the same bill as 615 on the House side. So, unfortunately not killed, but sent to interim study in the meantime. So, um, next slide, please. I think that that's what we kind of had for New Hampshire legislation. Laura, since you are here, is there anything else that I missed that has happened in the meantime that we wanted to mention? Oh, you are muted.
Um, Honestly, I just got here, so I'm not really sure what you said. So
Okay.
I'm sure you got everything. I'm
Great.
sure you did.
Okay. Make sure no updates in the last 5 minutes that I had missed. So okay, awesome. So wanted to talk a little bit about the Farm Bill because I know that we have talked about this in the past and talked about needing to contact our federal representatives to ask them to vote no on the Farm Bill, but wanted to give a little bit more background on what the Farm Bill is, kind of the breakdown of where the money goes that's in the Farm Bill, and then why we oppose the Farm Bill, and this particular version of the Farm Bill, rather. So, the Farm Bill is kind of the uh, fair to call it sort of a Swiss Army knife of American food and agricultural policy. So, it's a omnibus legislative package. It's Congress is supposed to reauthorize roughly every 5 years, and it dictates everything from national agriculture to food systems, environmental policy, so everything from how crops are grown and land is conserved, and how people buy food, and federal nutrition programs. So, kind of on paper, pairing these kind of agricultural subsidies with food assistance can seem sort of like an odd political marriage, but it's very much a deliberative or a deliberate strategy. So it was created historically as an emergency response to the Great Depression and to the Dust Bowl. So the first omnibus bill officially incorporated food stamps, now known as SNAP, in the early 1970s, and it ties these agricultural subsidies with food assistance, which allows allowing lawmakers to kind of create this bipartisan coalition that supports farmers and farming practices and buyers, including in most vulnerable populations. So next slide, please. Thank you. And first of all, thank you, Riona, for this amazing pie chart. This is great. So the money in the Farm Bill, historically, 80% has gone to nutrition assistance. So going towards helping people buy groceries through programs like SNAP. 10% has gone towards crop insurance and subsidies, which is kind of the safety net for farmers. So if drought wipes out a harvest, or global market prices crash, kind of the government can step in with financial aid so that farmers don't go bankrupt and cause a massive food shortage. 7% historically has gone toward conservation efforts, so pays for farmers to use more eco-friendly practices, so protecting soil quality, preserving water resources, and then 3% towards rural development. So kind of helps to fund infrastructures in small towns, and expanding broadband water systems, support rural businesses. So everything is really interrelated here. And a farm bill without SNAP is not, a farm bill at all. And dismantling SNAP hurts everyone. Sorry, Joanne, did you have a question? My audio is lagging slightly.
I don't have a question, sorry.
Okay, good. Okay, awesome. No worries. Sorry about that, everybody. Our internet is doing some strange things this morning. So wanted to talk about specifically why we oppose this farm bill. So HR1, which is the budget reconciliation bill, proposed the most aggressive SNAP cuts in the history of the program, projected to be 186.7 billion. The current version of the farm bill does not cut funding from SNAP entirely, but it does level these massive cuts, and kind of locks in this massive 186.7 billion cut over 10 years that was initiated in 2000, sorry, not in 2005, in 2025, in the budget reconciliation bill. So in April, the House passed this version of the Farm Bill by a narrow vote and failed to reverse the detrimental HR1 SNAP cuts. The Farm Bill has always made SNAP better and more robust. This version very much does not do that. The Farm Bill has always been bipartisan, and HR1 basically dismantles this bipartisan coalition, trying to defund and dismantle SNAP. And by passing this version of the Farm Bill, the House basically just gave approval to do this, which is going to, hurt farms. It's going to hurt farmers. It's going to hurt, people who are hungry and folks really in need of federal nutrition assistance. So, every dollar of SNAP benefit stimulates the economy. It increases demand for meat and dairy and crops that are produced, and by cutting SNAP, grocery sales drop, which directly hurts the farmers supplying these stores. Again, very much interrelated, and means that the federal safety net is kind of being decentralized in a way that would really have a huge negative impact on states. State budgets can't, we can't absorb billions of dollars in new liabilities. And if states are forced to kind of foot this bill, states might be forced to, dramatically or drastically restrict eligibility or slash benefit amounts, or, worst case scenario, opt out of the SNAP program entirely, as millions of people are already losing access to benefits, and have lost access to benefits over the last year. Next slide, please. Thank you. So, okay, how would the bill affect New Hampshire? It threatens thousands of residents by ending SNAP eligibility for lawfully present immigrants. It would remove the standard deductions that help families qualify, and impose really strict new work requirements on older adults, and I think parents of children who are 14 and older. So it would also kind of have a huge administrative uh, impact, so very much straining New Hampshire's budget by shifting the state's share of administrative costs from 50% to 75%. It might, require the state to pay for 5 to 15% of actual food benefits if the administrative error rates exceed a 6% threshold error rate. And Laura Ariano, please either correct me if I'm wrong or go into more detail on this, but is either an overpayment or an underpayment for SNAP. So just very small errors, and if exceeded 6% threshold. The current estimate in New Hampshire is around 7% as of 2024. And these combined measures would just drain millions in state funds. So it would be really hard to undo all of the SNAP cuts that have happened already. But what we can try to do is find an agreement to ensure that the Farm Bill supports people who are hungry and farmers and food systems. So we're asking and asking that Democrats not support or not agree to any farm bill unless it addresses the SNAP cuts and the cost shift delay for states. In New Hampshire, as former governors, Senators Hassan and Shaheen should particularly be able to relate to the kind of operational realities and state fiscal constraints that the time cost shift creates, need for states to have more time to prepare. So I'm going to drop a Farm Bill toolkit with resources for you to use from FRAC. Really urge you to email Senators Shaheen and Hassan, and we'll also drop a link for you to be able to do that and take direct action to get in touch with them. And reach out with any questions about the Farm Bill or any more information. And would highly recommend following FRAC's call to actions, and we will be sending one out as well, urging them to vote no on any farm bill that does not restore the money and cuts to SNAP.
I want to thank you so much, Finn. I would love to spend some time and take some questions right now, but in the interest of time, so we can get on to our next presentation, I want to encourage people to go to the chat with questions, and our team can share on that level. So thank you. That was really helpful.
Yeah, thank you, Sarah.
Yeah, nicely done. And here again, turning to Food Research and Action Center, and we will move ahead and take the questions to the chat if you have them. And I want to invite Jessica to talk to us about food as medicine, and Bethany on health equity.
Thank you, Sarah. Well, I think that Finn and Laura and Elsie and everybody that's already presented today has really set up why food as medicine in New Hampshire is so important, and all of the policy and systems pieces that are so important to get people connected to the food and nutrition that they need. So this presentation today, we're going to talk a little bit about where we started with the food as medicine work in New Hampshire and where we're going. Go ahead and next, Sarah. And we started with the state partnerships for improving nutrition equity state action plan. This was a program that was funded by the National Association of Chronic Disease Directors. It is affectionately called the Spine Project or the Spine SAP project. So we always thought that was a little funny, but when you hear SPINE, that's the State Partnerships for Improving Nutrition Equity. And we received this funding in 2022 to further look into our work around connecting people to the food and nutrition supports that they need. And we worked with the Department of Health and Human Services and Dr. Tejas at Health Equity Strategies on rolling out this project in the state. So we'll start off with like, what is nutrition equity? Nutrition equity is a state of having freedom, agency, and dignity in food traditions that will support the holistic health of communities. Researchers found that for a community's food system to be nutritionally equitable, 3 key factors must be present: economic opportunity, food security, and fair access to fresh and healthy foods. And that's from the American Journal of Clinical Nutrition. And then what is health equity? Health equity means that everyone has a fair and just opportunity to be as healthy as possible. To achieve this, we must remove obstacles to health, such as poverty, discrimination, and deep power imbalances, and their consequences, including lack of access to good jobs with fair pay, quality education, and housing, safe environments, and healthcare. And I just want to point out that when we talk about both of these definitions, they really talk about the root causes of both nutrition and health equity. And that's making sure that everybody has access to housing, good jobs, quality education, fair pay, safe environments, right? And we reference these as health-related social needs throughout this presentation. So in 2022, this was our first year of this project, and this was year 1 was our planning phase. So our goals were to co-create and implement a state action plan, expand implementation of social determinants of health screening. You can also replace social determinants of health with health-related social needs screening. So we're looking, when we look at those screening tools, we're, asking people, do they have access to food? Do they have access to housing? Do they have access to childcare? Do they need workforce development? What are the needs of that individual or the family? And then ensuring equitable access to federal nutrition programs like SNAP, WIC, and school meals, summer meals. So we talked about that today through the training of regional food access coalitions and healthcare organizations. And we worked with Dr. Tejas from Health Equity Strategies to use this framework, the framework for a culturally effective organization. And we worked with the New Hampshire FAC and all the FAC partners to go through each of these different pieces of the framework and to see how we could implement like data collection and analysis or community engagement or language and communication access into each community-based organization or state agency that was participating, and how these things would play out, this framework would play out in their organizations to improve nutrition equity. Next. So in year 1, we had a state action plan. We had over 80 organizations that participated in the SPINE process. 43 organizations there were 43 organizational nutrition equity action goals. And it was because those were collaborative that there weren't 80, because in that 43, multiple organizations would sign on to a goal. We had 9 community consultants who were paid for their time. These were community consultants with lived experience who advised the plan, participated in meetings, and had their own meetings where they advised our presentations and actions that came out in the state action plan. We had over 250 direct service providers attend a SNAP training. These were multiple trainings that were offered by Ray Burke at New Hampshire Legal Assistance all around the state around SNAP and some of the nuances of the application. And then we had 13 healthcare organizations start to set up systems to screen for hunger. We were pleasantly surprised by additional funding from the National Association of Chronic Disease Directors in 2023. And we also received some additional funding from the CDC to start to implement our state action plan. And part of our goals for that were to create a subgroup dedicated to nutrition equity, to create an action plan that would have priorities for our nutrition and equity work group. We would deliver a training series that covered culturally effective orgs framework and where it intersected with community clinical linkages. So that's connecting the community members directly to their healthcare system or their public healthcare system, and also back connecting the healthcare system and the public health system back to their community, and also social connectedness. If anybody hasn't heard, social connectedness or lack of social connectedness is the new smoking or sitting. So research has shown that if people aren't socially connected, that they have worse health outcomes. So we would need more people to be socially connected to have better health outcomes. And we were also to provide technical assistance to healthcare organizations to screen for health-related social needs and help people get referred to services. And the outcome of our 2023 work was that we had one nutrition and health equity work group developed. We had 170 attendees at the Nutrition Equity Summit. We had 24 leaders from around the state participate in designing and leading the 6-part training series to improve nutrition equity. We had 12 members start a nutrition and health equity work group made up of our public health partners, healthcare partners, community-based organizations, and state agencies. We had 20 evaluations of our year 1 activities, those 43 activities we talked about before. And we had one Medicaid policy that was within the New Hampshire Medicaid managed care organizations to reimburse for health-related social needs work, as well as nutrition education and care coordination. So there is a current Medicaid policy that will reimburse healthcare organizations or any Medicaid provider for that work. And then, so where are we now, right? So we're looking at the state partnerships for improving nutrition equity from 2024 to present. So our accomplishments for 2024 and 2025 is that our work group has continued. We have received 2 more grants to fund the food as medicine work through the Endowment for Health. And we have some funding coming from Jean Shaheen's office through congressionally directed spending. We have over 100 community-based organizations that attended New Hampshire Care Connections kickoff presentations through our coalitions. We have over 60 members now of our nutrition and health equity work group that are all collaborating on food as medicine projects. And we're going to get into that a little bit more, but we're really focused on the policy and systems changes and how we can support programs. So we're not working on programs as much in this work group as we are how do we develop the policies and systems that are needed in order to make the programs possible. We have 10 coalitions that continue to host, and these are local food access coalitions or food councils, food collaboratives. They all have different names all around the state. And because every region of our state is a little bit different in how we approach nutrition access or nutrition equity. But those 10 coalitions continue to host federal nutrition program trainings. They are developing and engaging in grassroots advocacy, as you heard earlier in this meeting. They are also engaging their community members to learn more about how they can improve the food system. They're working on evaluating how current programs are working. So they're doing a lot of work in those local coalitions to make sure people have access to food and nutrition. And also, there was the first closed loop referral that was completed in dairy. So that meant that somebody was screened for health-related social needs, referred to a community-based organization for services, and that community-based organization connected with the person and got them connected to the service, closing the loop. So we talked about those priorities that we had to create. So those nutrition and health equity work group priorities are to facilitate Medicaid waiver opportunities, to reimburse for health-related social needs and food medicine projects, to look at a shared data plan to support the development of that, and how do we measure the impact of health screening for health-related social needs and connecting people to food as medicine projects, federal nutrition programs, and other health-related social needs like housing, childcare, education. We're working to connect and refer people to the federal nutrition programs. We're having a lot of conversations right now about workflow and what does that look like? You know, who's the person helping somebody with applications? How are they then connecting somebody to food as medicine services? How do we know what's happening in the state, right? So in order to connect people to those things, we also have to know about all of those different programs and services. We are looking at how to streamline, and we are, you know, oftenly at the federal level and the state level looking at how can we create direct certification opportunities to connect people from Medicaid to SNAP WIC and school meals. We are training. So we talked a little bit about the training before, providing technical assistance on the application process for SNAP WIC and school meals. This work group isn't the one that is always doing that, but we are working to always connect people to those trainings that are happening around the state. And if there's somebody asks for that training, we're connecting them back to the person who does the training. So for instance, the food bank talked about their SNAP outreach training. We then promote that SNAP outreach training to our coalitions and to other members of our nutrition and health equity work group that are interested. And then we are engaging. We're looking to conduct local and state food and nutrition access assessments to identify other policy and systems environmental changes needed to address nutrition and health equity. And we'd like to do that through community engaged processes. So we're asking people with lived experience, you know, how can we improve these systems? So again, like why are we talking about this at the New Hampshire FAC? Why are we talking about it from the New Hampshire Hunger Solutions perspective? And if you can see at the bottom of this food as medicine pyramid, our preventing people from being food insecure, preventing health disparities, they're at the bottom of the pyramid. So we know those population level healthy food policies and programs are the key to prevention. And I don't have to really go into detail about those because we already talked about those population healthy food policies and programs today. So we're always advocating for those policy pieces. The second level of prevention is the nutrition security programs like SNAP, WIC, and school meals, summer meals, the child and adult care food program, which is food that's offered at daycare and older adult care centers. We know that when we connect people to those programs, that we prevent chronic disease, we prevent hunger, people have more access, they free up more dollars, so they have more access to affordable housing, they get more connected to healthcare and other social programs. I see everywhere that if somebody is, you know, eligible for SNAP, that they're also eligible for other programs, right? So it's always connecting people to more services that they need and leads to prevention. Then as we move towards treatment, we're looking at produce prescription programs, medically tailored groceries, and medically tailored meals. And these show up in a lot of different forms in our community. Some are offered by healthcare, some are offered by our community-based organizations. And our work group is working to be the thread that strings all of these together to make sure that we're connecting people to all of them, but that also all of these programs are talking to each other to make sure people are getting everything that they need. And I just want to add that nutrition counseling and education is needed all throughout every level of the pyramid. So when we talk about ways to leverage Medicaid, right, we talked about Medicaid waivers. They can be really helpful in paying for food as medicine, right? You get a prescription for medication to treat your condition. You can also get a prescription for food to treat your condition. We know, I mean, right, the apple a day keeps the doctor away is a saying that's been around for centuries. We know that when we have the right food, that we can reduce our health or improve our health outcomes and reduce chronic disease. You can see that in these numbers here that there is 3.28 million cases that were prevented in cardiovascular disease in just 1 year of studying food as medicine programs, where they used Medicaid waivers to pay for healthy food. So there were 120,000 less cases of diabetes that were prevented or postponed, and there were over $100 billion in savings. And they found that food as medicine projects would be cost effective after just 5 years. We talked a little bit about a shared data plan, and this is just a way that Medicaid healthcare providers and community-based organizations are agree to talk to each other so that they can talk about how, when, and why confidential patient information is shared between organizations to improve care coordination and social outcomes. And this comes from the Centers for Medicaid and Medicare. Next. And this is an image of what that can look like. Patients report on their health-related social needs. A navigator helps that patient connect with community resources to address their health-related social need. They are then connected through a closed-loop referral system that is integrated into the healthcare records, and that closed-loop referral system connects them to services through their community based organizations or through their healthcare providers. I think the bubble missing in this image is the Medicaid managed care organizations in New Hampshire that they get referred to as well, because they have programs and services that address like transportation. They provide transportation to food appointments, to pantry appointments, to the grocery store, to medical appointments. And so, they have medically tailored meals that are delivered to people's doorstep for 2 weeks post-discharge. And our work group is working on really making sure that these workflows are happening and making sure that people are getting connected to all of the programs and services, and then also making sure that all the programs and services complement each other. Next. So in New Hampshire Care Connections is one of those programs and projects that helps to facilitate that shared data. This is being led by New Hampshire Health and Human Services in partnership with the Department of Military Affairs and Veterans Services. Also, Granite United Ways 211 is integrated into the closed loop referral system. And the Unite Us closed loop referral system is the software that's being utilized to do those closed loop referrals. And next slide.
Sorry, I'm not sure what happened here. It looks like I fell out of presentation mode.
Yes, it looks like you're in a different tab, Sarah. The presentation, there you go. Oops.
Oh, that's usually the spot I go to for next slide.
Okay. Well, this is the next slide, but then we'll have to skip ahead because then Bethany's slides are in there. But just to say that the New Hampshire Care Connections, these are slides from the New Hampshire Care Connections website. Anybody can access them and take a look at these slides. They're made available to the public, but it's looking at the whole person care. And that includes the physical, behavior, emotional, and social services. So again, addressing the root cause issues of nutrition and health equity. And from here, I'm going to turn it over to Bethany from Unite Us, who is going to talk to us a little bit more about that closed loop referral system as a part of New Hampshire Care Connections and how it is supporting our work in New Hampshire.
Hi, everyone. Thank you, Jessica. Thank you, Sarah. So my name is Bethany Morabito. I work on the community enablement team here at Unite Us. I am New Hampshire based. I live in Henniker, and I have been a part of the New Hampshire nonprofit scene for the past 20 years. I recently joined Unite Us about 3 months ago in time to help them start to develop the New Hampshire Care Connections Network with intentionality across the state. So you might have heard of Unite Us before. I know some organizations have had the opportunity to be on Unite Us, maybe experienced a little bit of whiplash with stuff happening on the state level, but Unite Us is back. We're looking to build trust in New Hampshire, especially with our nonprofit partners and community members. So before I kind of get into the nitty gritty, I want to be able to offer the people in this room that were interested in scheduling in-person listening sessions and show demos and workflows about how our software can help organizations better understand our platform and help connect people to care, which is ultimately, what we all care about, is making sure that underserved people get the resources that they need and improve health outcomes across the state. So Unite Us is essentially can you go back one more slide? Sorry. Unite Us is essentially the closed loop referral system where the technology that offers the platform so organizations can send and receive referrals and be able to track that pathway, as Jessica mentioned, closing the loop, being able to see the track of accountability and how somebody moves through the system through different resources and making sure that they're connected to those resources. Within the platform itself, you have the ability to conduct screenings and do intake. And we also provide robust data and reporting, which is accessible to organizations. Coming onto the platform is free for nonprofits with unlimited licenses. As I said, we're trying to build this network back up intentionally within the state. Okay, next screen. Thank you. So essentially how it works on Unite Us is that in this example, we're going to use Sue. Sue is a staff member at her local food bank, and she receives a referral for Kristen from Dartmouth Health. That could be any kind of regional anchor, local hospital system, but in this example, Dartmouth Health. The referral indicates that Kristen has a food insecurity need identified during the screening process that, when she went to her appointment at Dartmouth, was determined. So Sue reviews the referral in detail to confirm eligibility for Kristen and also to see if her organization has the capacity to serve Kristen. Sue then accepts the referral when she determines that they are able to provide Kristen with the resources she needs. So she uses Unite Us to confirm that the food bank can support her. Dartmouth Health is then notified in real time that the referral was accepted and is being addressed. So Sue will reach out to Kristen then and coordinate her food assistance and ensure that Kristen receives the appropriate groceries and nutrition support that she's looking for. And all of those outreach and services and touch points are documented within Unite Us. Sue also has the ability to message the team at Dartmouth to ask for more specifics, or they can speak back and forth in a secure platform to be able to talk best about how to meet Kristen's needs. Sue also can share her status updates back with Dartmouth within the platform, talking about progress or any barriers to that they've encountered along the way. And if Kristen has additional needs that surface when she's coordinating with Sue, Sue can also use Unite Us to send referrals out to other community partners. So, perhaps that might be health insurance benefit assistance. Maybe that she needs assistance with infant supplies or transportation or housing. All of those kinds of referrals can be sent throughout the platform. So once Sue is able to provide the services for Kristen, she's going to close that individual case and record the outcome of that case. That doesn't mean that her work with Kristen stops. Oftentimes, we have touch points with our clients and our patients over a period of time, over a period of years. But this is documenting the individual case of the occurring need. So Kristen would successfully then be connected to her food support, and there would be great reporting data that demonstrates impact for the food bank and for Dartmouth Health. And the hope is that we'll be able to, once this network is developed and healthy, and we have lots of great organizations using it, we'll be able to see those data patterns across the state, see what the needs are, see what regions of New Hampshire have the highest needs, and be able to address them with some really great data points. Next screen, please. Oh, so Unite Us right now has started its launch, or has been launching in the Upper Valley first, specifically. That was the first region of New Hampshire that was identified. So Dartmouth Health went live on the Unite Us platform on April 29th. So it's been almost a month of them being live on the platform. So they have a combination of their different community health workers, social workers, their care coordinators at 4 different locations throughout the Upper Valley. They're phasing different programs on. I believe ambulatory care started. That was a team of 75 individuals through Dartmouth. And we're currently working with Dartmouth to help train and bring on more phases of their different departments onto the platform. But they have already started sending out closed loop referrals to community partners across the state, and specifically within the Upper Valley. As mentioned before, New Hampshire Care Connections is the name of this project. Unite Us is the technology platform that's supporting the project. So just as a general update about our progress in the Upper Valley, organizations that have recently joined include the Monadnock and Sullivan County ADRCs. All of the ADRCs will be rolling onto the platform. We're also phasing them by region. The HIV/HCV Resource Center, Friends Program, TLC Family Services, Listen Community Services, Archways, Lebanon City Welfare, Counseling Associates, and in the pipeline right now, who are in the process of onboarding, we have Grafton County Senior Citizens Council and all 8 of their senior centers, which is really exciting. CVTC, Twin Pines Housing Trust, and Community Kitchen. So we are, oh, thank you very much, Jessica. Yes, ADRC, Aging and Disability Resource Center, formerly known as Service Link. So yeah, that's just to give you a general idea. As we're moving through the different regions of New Hampshire, we might be coming to your area soon. We might reach out to you. We'd love to have a conversation to learn more about the individual work that organizations are doing. We want to ensure that there are nutrition, that there are food assistance providers on the platform that are going to be able to respond to referrals and the community needs. So we're just very excited. We're going to be looking to move into the capital region next. And we will be going region by region throughout the state. So if you hear Unite Us popping up or in conversation, that's kind of the plan of this launch within the state of New Hampshire. We're looking to really make that Community Care Connections project work. And I invite anybody to reach out to me. I see Kathleen in the comments about Lime Food Pantry. I'd love to have a conversation. My email address is in the chat. If I don't want to take up too much more of your meeting, but if anybody has any questions, please feel free to drop them in the chat and I can answer them for you. Or if there are any pressing questions, I can answer them now. I see a question in the chat. Does the food assistance provider receiving the referral screen for eligibility for underinsurance coverage? Or is that done at the referring partner level? Usually that would be done at the referring partner level, but the receiving organization in their how their organization is presented on Unite Us can put in their eligibility requirements. So if there are eligibility requirements as far as being able to provide the service, we want to make sure that that's detailed pretty specifically. If there is a form that needs to be filled out prior to somebody receiving a referral and having that done, we can link any sort of assistance request form or any sort of documents that might need to be filled out prior to being able to receive the referral. The organization also has the ability to hold the referral for review, so that they can determine those details and ensure eligibility and capability. So Yeah, and also information can be communicated back and forth between that secure messaging feature within the application itself if information needs to be shared that way. All right, well, thank you. Thank you for hearing my spiel about Unite Us. We're really excited about the opportunity to be able to grow this network across the state again. And thank you for giving me the opportunity to speak both to Jessica and to Sarah. Yay. I'm going to drop because there's been a lot of comments, I'm just going to drop my email again in the chat.
Thank you. And Sarah, I know you skipped ahead, but if you could go back to what we've heard just really quickly. And we won't have time to engage people as much as we would like to, but if you could go one more ahead. I just want you to know that we've been listening around the state. We've been doing lots of one-on-one meetings as well as this group. So after a group meets, we talk one-on-one or we go to coalitions. And I just want to know that for everybody to know that, like, as the facilitator of this group, that I'm hearing you, the group is hearing you, the healthcare organizations are hearing you, the Medicaid managed care organizations are hearing you, New Hampshire DHHS is hearing you, and like we're all working. And I think that it's really important that, again, we all kind of work together. So we've heard that community organizations have limited capacity to carry this out. There might be another system in place. We need to build trust with the system. We need to gather more voices of lived experience, and that we know that direct certification isn't favorable right now. We know on our healthcare side of things that healthcare organizations need more people to refer to. They're continuing to work on those billing code workflows and getting reimbursement for food as medicine projects as needed. We do want to continue to know if we've missed anything. So Sarah, if you can go to the next slide. Please let us know what else we should know if we've missed anything there. You can put your thoughts in the chat now, or you can reach out to me. I put my email in the chat. Next slide. And we would love to explore solutions with you. So locally, you can connect with your community health workers or healthcare navigators and your Medicaid managed care organizations. I'll give Sarah some attachments that she can send out to you that is like a one-pager to connect to our managed care organization services, and also to learn more about the billing codes. If you're a Medicaid provider, there's billing codes that will reimburse you for the screening, referral process, care coordination, and nutrition education. We would love to coordinate with coalitions to host listening sessions about the closed loop referral system. As Bethany was just talking about, they've started that in the Upper Valley and are moving to Concord, but would love to hear from other regions that are interested. We have a client experience study that we're learning more about how people are experiencing federal nutrition programs, what the barriers and opportunities are to that. And we are continuing to explore opportunities to create policies with insurers to reimburse for services. And please let us know if there is more we need to know. But these are things that you can do with your coalitions, is continue those training opportunities. Invite WIC to come do a WIC 101. Unite Us will come and do a community conversations. New Hampshire Hunger Solutions is right now recruiting for the New Hampshire School Breakfast Challenge. Learn more about that. And through the food bank and New Hampshire Legal Assistance, you can learn more about the SNAP application and how to make sure that people are getting connected to SNAP as smoothly as possible. And again, we're the client experience study. You can reach out to me about that if you're interested. That's part of the New Hampshire Food Accesses Coalition's Nutrition Action Research Network. And that's good, Sarah. Thank you.
Thank you, Jessica. That was amazing. As we wrap up, remember, everyone, I have a special treat for those of you that made it to the end. I'm about to drop it in the chat. But remember, our New Hampshire Food Access Coalition is this group that's here today, but it's also this umbrella for some statewide working groups and coalitions. So our SNAP coalition we heard from today, Jessica spoke about the New Hampshire Nutrition, Health, and Equity Working Group. That was a lot of what we talked about today. And then she mentioned also the New Hampshire Nutrition Action Research Network, which is right now focusing on that client experience study. And then we also have our local and regional food access coalitions. So much great work, such a fun web. I loved seeing that web in the Upper Valley too. So awesome to hear more about that. Thank you for sharing. Next month, we'll be talking about summer food access. We will be giving the best information we have up to date about opportunities for food and nutrition assistance in the summer, especially for kids. Since this is more of a concern in the summer if they were getting meals at school during the school year. And we have 1 minute left. Tomorrow, for those of you that do not know, the world's largest taco tour is happening in Manchester, New Hampshire. So if you're there, I will be there. Say hi to me. If I have my mouth full of tacos, just give me a minute. And I hope to see some of you there. I'm very excited. Has anyone been to the Manchester Taco Tour? This is my first time.
It's incredible.
Yeah.
Find a good parking spot.
I'm also in Henniker. I'm parking at my friend's apartment, and I also live in Henniker. So Bethany, we'll have to connect sometime too.
I would love that. That would be fantastic.
Awesome. Well, everyone, have a great rest of your day. Thank you so much to all our presenters, and looking forward to seeing you next month. Bye, everybody.